Welcome everyone to our Hearthside Chat series. My name is Christiane Schaeffler. I'm a cardiologist in Santa Monica at Pacific Heart Institute, and I'm really excited to welcome you to another part in our Hearthside Chat series. We have an organization that's a charity called Have a Heart, Save a Heart, and as part of that charity, our mission is to do a lot of education, particularly around women's heart health. Our main educational event is a large symposium centered on women's heart health issues in February every year. There was so much enthusiasm around that event that we decided to keep the excitement and education going all year with these smaller series. Here we are in a beautiful home with a small group of women and men, and learning about kind of areas that are affecting cardiac health, but in other organ systems. So today we're focusing on the gastrointestinal system, and we have two big experts in the field. We have Dr. Nicole Weinberg and Dr. Lenna. So I was thinking maybe they could introduce themselves.
Hi, I'm Dr. Lenna. I'm a gastroenterologist at Digestive Health Associates here in Santa Monica, affiliated with Providence. And I'm here to hopefully educate on the microbiome.
And I'm Nicole Weinberg. I'm a cardiologist that does a lot of non-invasive work and preventative health, focused on women's health in Santa Monica at St. John's as well.
Great. So we came up with this idea because we regularly will see patients in our clinic that ask us the question, what should I be eating? I've had this heart event, or I'd like to prevent something from happening, and I want to know what to eat. I'm reading all these things. I know how I feel when I eat certain foods, and can you tell me kind of what to do and what's important, kind of focused on the goals that I have. And so I'm just wondering, what do you think about when you talk to patients? What do you feel like is so important with digestive health, and how do you get the conversation started?
Well, for me, I very significantly believe that we are what we eat. And so if you're putting something good into your system, you will generally get good things out of your system. And so from a cardiovascular perspective, we're always trying to encourage people to eat very healthfully and mindfully, not just eat whatever they want, whenever they want. Cutting back on sugars is very helpful because it can be very pro-inflammatory, and that can lead to a variety of other medical conditions. Additionally, we talk a lot about the Mediterranean diet and getting a lot of plant-based proteins when you can, to reduce some of the pro-inflammatory states that you get from certain meats, certain red meats and other things like that. So I feel like along the way there's a lot of overlap with the digestive system and cardiovascular health when you're just trying to be a healthy person and put good things into your system.
Yeah, I agree. I mean, you are what you eat, and we're seeing it so much in digestive health diseases as well. We're focused today on cardiovascular, but you're going to find that digestive health is involved in many disease systems throughout our body, and we're going to touch on some of the important ones today, but there are many more. So it's really important to think about what you're eating and follow the evidence. It's changed over time, and we're learning more and more, and I know my practice has changed over time as we learn more and more about the importance of the different molecules that are in our food.
And I think there's been a lot of kind of microbiome as a buzzword, and a lot of patients are coming to ask about it. And we think about also what's important, with women and digestive health. And there are certain, disease states that are more prevalent in women, such as small intestinal bacterial overgrowth or irritable bowel syndrome. So how do you think about the microbiome when you talk about, health with your patients?
So bacteria is one of the, main functions in our digestive health, in our system as far as symptom control and so forth. So what I usually, when someone's coming to me with, symptoms that are quite common, which bloating and bowel changes, I want to get to the root of the problem, which in a lot of patients does come down to their microbiome, how they're eating. But I try to split it into three major components. One is the microbiome. Two is the food you eat and your ability to break down foods. And then three is the nervous system, brain gut health, and a lot of times they're all tied together. So I start with that, and usually we are able to make great progress. So.
It's interesting because I do end up seeing a lot of patients that come to me because they're trying to, lower their cholesterol or lower their blood pressure or lose weight. And you realize how much of an overlap there is when you're talking about your digestive health and your cardiovascular risks. And so one of the things that I feel that we see a lot is people trying to supplement a lot to make their gut more healthy so that they can change their diet and lower their risks of cardiovascular disease. They're cutting out certain foods to lower their cholesterol. They're trying to lose weight to lower their blood pressure. But in the process, they might not necessarily be doing all the right things in terms of their body. So we do find that there is quite a bit of overlap as it relates to your gut health and your cardiovascular health. I'm not sure how much you talk to your patients about plant-based foods versus animal-based foods, but that is one of the things that comes up a lot as it relates to cholesterol management. And so as a preventative cardiologist, I see a lot of patients that say, well, my cholesterol is really, really high. How can I cut back on that? And what will that do to affect my overall cardiovascular health? Obviously, a lot of foods that are from animals have cholesterol in them. And so those are things that can raise your blood cholesterol. And so if you're trying to cut some of that stuff out of your diet, a lot of people have questions about, what is that going to do to my overall body health and my microbiome, and will I still be a healthy person if I cut some of these things out of my diet?
So in general, the healthiest microbiome you can have is going to be a microbiome that is is fed plant-based foods. Plants contain prebiotics, which are fiber and polyphenols. These are large molecules that your own body cannot digest. And when they hit your colon, where the quadrillions of bacteria live, they are broken down into smaller molecules that will enter your body. And these we're at the very beginnings of learning how important these small molecules are in many disease states. And if the bacterial environment is disrupted, something called dysbiosis, they may break down into molecules that are unfavorable for your health.
There is something I have a lot of patients that come in myself and they ask, but if I eliminate, if I'm only focused on plant-based foods, how am I going to get my protein? How am I going to get other kind of nutrients? And I wonder how you address that question. Sometimes I'll mention the recent research with trimethylenamine oxide, which is a byproduct that gut bacteria make that can be pro-atherogenic or pro-thrombotic. And I cite that as a reason to maybe stay away from a meat-rich carnivore diet. I'm wondering if there are other things, how else you might address that question.
I, in general, address it with, number one, plants have plenty of protein. Number two, we're all grown adults. We're not maybe needing as much protein as we've read. Your liver, if it's healthy, is generating protein, making everything you're eating. It can break down carbohydrates and create proteins. And so to me, there's a lot of fad diets that come in and out. It often feeds a lot of supplement taking, which I don't feel is a really great thing. I think in general, you should be able to heal most of your microbiome without any supplements and just eating the proper foods. But it's hard because we live here, so.
Well, and I'm thinking about like how many patients that I see and how many people that I know that are taking like protein powders and special shakes, and I think there's a thought that that's going to make them like fuller, faster, or, it kind of harkens sometimes also back to some of the specialized diets where people are eating like a high protein keto diet and they're supplementing and doing all these special things, and how we have seen in our literature, in the cardiovascular literature, that is really not something that gives you good cardiovascular outcomes. In fact, it's quite the opposite. Most people have increased morbidity and mortality associated with those type of diets.
Yeah, and I mean, this is how practice has changed over time. I think a lot of us, when we came out of medical school, were thinking about, lowering, the epidemic of obesity, and lowering carbohydrates is most important. And really, it's not about that. It's about the quality of carbohydrates that you're taking in, and what's within the carbohydrates that you are eating. And so, for instance, whole grain foods, they're full of fiber and many of the polyphenols that we've discussed that feed your microbiome. You're not going to get that in meat and dairy. And although you might have rapid weight loss by going no carbs, you will not have lasting health by that, that approach. And so it's, not a one size fits all. Everyone's body is a little bit different. And when I'm meeting with patients, I'm always trying to get to, what's going on in their life, what's realistic. Can't just be like, just go grow your own food and, eat only what you grow. I mean, we live here, we're bombarded with a lot of processed food. We're living fast-paced lives. We got to get our kids to practice, and we got to get dinner on the table. So it takes a lot of organization to eat healthy. And so I try to, discuss with patients how important it is to not get too stressed about it either, to try to start making changes that are realistic, that are going to start to promote your health. Be a reductitarian. You don't have to give up all your meat. Actually, if you eat predominantly plant-based, when you eat a steak, you're not going to have the same bad outcomes as you will because of the microbiome that's living in your system. So your good, healthy microbiome will be able to break down the steak and not lead to some of the bad chemicals that happen if you're eating it more rarely.
And they've actually done those studies in mice and in humans. Eating, somebody who's primarily vegan or vegetarian produces almost none of that TMAO that I mentioned over somebody who has a more carnivorous diet, which is pretty fascinating. And I think we were talking earlier about what percentage of your person is bacteria, so that if you change what you eat, you quite literally change who you are, which is a pretty incredible 99%
concept. Of the genetic material in your body is from bacteria. So we literally are like, we are bacteria. And 1% of your genetic material are your human cells.
And even if you're related to someone, you may have a completely different microbiome than they do based on that consumption. So I do have a lot of patients that I'll counsel about eating fiber-rich diets because it drives down cholesterol. Eat lentils and beans and vegetables, and then they stop me and say, I really can't do that because I'm battling this gastrointestinal disease. And so we talked a little bit about healing your gut, and then maybe you could pursue those. I wondered how you approach those patients.
Yeah, like more specifically, there are some patients that have inflammatory bowel disease, Crohn's disease, SIBO that we have talked about, and how those patients we do have to pay very close attention to because they have a chronic level of inflammation within their gut. But just because it's in their gut does not mean that it can't hit other organ systems. And so if you look at some patients that are suffering with chronic medical conditions such as gastrointestinal conditions, their leading cause of death is going to be cardiovascular disease. So it is really important that we dial into these patients and not have them completely solely focused on their gastrointestinal issues and taking steroids and all these things that can be very disruptive inside, because they can cause a lot of cardiovascular risks. There's a lot of atherosclerosis, plaque buildup that happens in their system. Their cholesterol levels can go up very, very high. They can have blood pressure changes that fluctuate quite significantly, and those are things that can lead to very bad cardiovascular outcomes when they're really not paying attention to their heart at all because they're very much focused on their gastrointestinal issue.
Yeah, it gets extremely complicated in patients with especially small intestinal Crohn's disease or inflammatory conditions that affect the small bowel, because it is very tough for those patients to eat all the fiber that we are promoting to help reduce inflammation. So they're in a catch-22 situation. And so for those patients, my approach is, try to heal the gut and then focus on the prevention. And that's where, medicines come in. That's where other lifestyle changes that are really important, like stress reduction and addressing the brain-gut connections are really important for the overall function. And so, in those patients who are like, I can't eat lentils, it's high in FODMAPs, or, my approach is like, let's try to get you, your SIBO under control. By the way, SIBO is small intestinal bacterial overgrowth. It's a condition where the bacteria are overgrowing your small intestine where you're digesting food. They start to create the breakdown of foods in your small intestine when that stuff should be happening down in the colon. It's creating a lot of gas and bloating and discomfort. It's thankfully not as dangerous as like Crohn's disease, something that's actually digging an immune disease that's where the immune system is attacking the wall of the digestive tract. But it can be very difficult to live with SIBO. And so usually we need to address the SIBO, but also what is causing the SIBO. And so is it your diet? Are you feeding, are you giving the bacteria sugar and things they love to create a lot of replication? And is it your anxiety that's slowing your gut down and not allowing the natural cleaning waves that our body has? Bacteria, they want to go where the food is. It's Vegas up in your, it's a buffet up there. So they're headed up there. And so your own body should be able to control that. But there's so many things in our fast-paced lives that disrupt this. And so that's why we see more and more and more of it.
It is kind of amazing when you think about, I think the buzzword of inflammation within our body is a very loud issue that we talk about. We had another Hearthside Chat where we talked about inflammation with our rheumatology colleagues. So patients that have lupus or rheumatoid arthritis or scleroderma, they are more predisposed to cardiovascular disease because they are suffering with chronic inflammation. But if you think about gastrointestinal health, from mouth all the way down, there is so much that can be pro-inflammatory, and the way that correlates with cardiovascular disease makes us, really quite interwoven in terms of the disease processes. So I do think that when you think about therapy you almost can't look at it just alone. You can't just look at cholesterol state as they come back. You have to say, okay, well, what are you being treated for? What other medications are you on? What's going on that may be activating you in these times? And we do see that a lot when we do biomarker testing. So we do advanced lipid testing in our office to check the basic cholesterol numbers like your LDL and your HDL and your triglycerides, but we also look at other markers of inflammation, and those markers of inflammation can have their rise and fall as the patient is suffering from other medical conditions, and we're looking for a homeostasis within your body so that you can have one thing under control and hopefully also lower your risks of the things that could actually cause you to have a heart attack or die.
So I have this gut feeling that there's more to this than just changing your diet. So I'm wondering, how do we address that anxiety part of things? when people maybe are not feeling great and they find that maybe their GI tract isn't either. How do we address that in clinic? How do we advise our patients? What recommendations do you have?
The brain gut is one of the most closely tied organ system. The gut runs on many of the same neurotransmitters. There's lots of evidence showing the gut communicates with the brain and the brain communicates with the gut on a constant basis. And we all know this as humans because, we've been there. Yeah, I'm nauseated because I'm in front of a camera, we all know when we get nervous, we feel it in our gut. We get a gut feeling when we feel like, I'm not in a safe place, I'm not a safe person, you feel it here. Some people, it's very sensitive, the brain-gut connection, and it's inappropriately sensitive, and there are reasons why that may be, and that can date back to early childhood and experiences back then when the nervous system is forming. But it also may relate to the microbiome, and if you're not if you don't have a healthy microbiome, the chemicals that are being broken down are getting into the bloodstream and communicating with the brain and causing, can cause depression and anxiety. And so it's all tied together. So I incorporate a lot of therapy. I think, I use meditation and hypnosis apps. Just even learning diaphragmatic breathing is a really important skill to not only reduce anxiety, but also reduce abdominal pain. And so just breathing into your gut and doing that multiple, 10 minutes a day or something can really reduce a lot of the mental health issues as well as digestive health issues.
It's funny because as you're talking about it, I think that patients come in with like their organ system that gets hit when they have stress. Like some people get a glaring migraine when they have stress, or some people come to the cardiologist because they have either chest pain or heart racing or palpitations. And so there is quite an element of that overlap of the connectability of it. And there are certain drugs that we use in cardiology that may hit multiple different receptors, like a beta blocker, for example, may hit, be able to slow the heartbeat, but it also may kind of dampen some of the adrenaline surges that are going on in the system. So it's interesting to think about when you're talking about therapy is for, how there could be like an emotional override of what's going on in your body that you would draw on, kind of different pharmacologic and or biofeedback type of tools.
I kind of joke, but I really do probably start more psychiatric medicines than a psychiatrist. So all day long, and it works because calming that serotonin pathway really works. And always the goal is not to be on long-term medicine, but sometimes getting the medicine on board. Helping people realize the connection, then they can start working on the things they need to work on. And for everyone, it's a little different.
And I wonder if some people are more interested in starting these medications because it's for something within their GI tract, and it's not because of a mental health diagnosis that they have, but it's actually targeting everything.
Right. I think I probably can convince some people who maybe have been told by other health professionals that they may need it for this, that, and the other, but it really will help the gut function. And so, so it's a really good tool to start to get the whole body in, balance.
So I also wondered about kind of when you're approaching kind of from a prevention aspect, kind of how we can address kind of our overall health picture, whether we have an existing medical condition or looking to kind of prevent something from happening. What would be your approach there?
Well, I mean, I do think that, I kind of talk to patients about everything in moderation. You want to make sure that you're eating a healthy diet. You want to make sure that you're exercising. You want to make sure that you're sleeping. You want to make sure that you're, doing things such that you're kind of building up what is in you so that you can be on less medications and hopefully ultimately have good reserves within your system to be able to fight infections and to be able to stave off, certain disease processes. But it is interesting as we're talking about it that I do feel a lot of it is coming back to, kind of you are what you eat.
Yeah, it's true. I mean, I think, if you look at the studies, you have a protective mucus layer in your, in your digestive tract. And essentially, if you're feeding your microbiome what they want to eat, they'll leave that intact. If you're starving your microbiome of the fiber and polyphenols and, the prebiotics we're talking about, it will start to munch on that lining. And then the bacteria gets close to the bloodstream and immune system, and then the immune system goes into override. It gets scared. It's like, whoa, there's 14 trillion bacteria really close to us, and that drives your inflammatory markers and cytokines up, and that is leading to all of these diseases, not just cardiovascular, but all over our body.
And just looking at some recent data, I found it really interesting that patients, for example, with heart failure might experience more of a leaky gut because of that decreased cardiac output and gut edema. So I think for us as cardiologists, recognizing the ties is really important to think about how to repair that systemic issue where the heart is not pumping normally, where actually there is fluid around the gut, so it's not absorbing all those nutrients, and it's leaky. So it could be leaky for many reasons.
I don't love the term leaky gut, but I do agree that that is the scenario where it truly is a leaky gut. I think a lot of people use that term to describe their functional bowel problem, which I don't fully agree with. But in heart failure, fluid overload, you will get edema between the cells, and that likely has an impact, which we're learning about.
Yeah, it is interesting when you think about patients with congestive heart failure, because you do start to notice there are some people that store a lot of their fluid in their abdomen instead of in their legs, and they may store it in both places, but how all of that fluid in there causes their bowels to slow, they get very constipated. Sometimes that's the first warning sign that they've got, like a congestive heart failure episode, because they find that everything slows in there. And for sure, if you're dealing with a patient who is in need of really good nutrients to get their cardiovascular system to feel better, if they don't have good permeability between their gut and their bloodstream, then you're going to have a lot of problems.
And I think that's also kind of a reminder about all the different bacteria that might colonize the gut, the oral kind of mucosa, and taking care of all these distinct areas that seem like I'm just going to brush my teeth today, or I'm just going to eat a healthy meal, but they're all sort of connected. What would be a common reason that you've been referring people to Dr. Mardiak recently?
Well, I think that when you think about preventative health, which is something that I see a lot of patients with, we do want them to be seen by a gastroenterology, have a full team so that they can have colonoscopies, can have good screenings, especially when we're looking at patients that have cardiovascular disease. We may be talking about medications that would be blood thinning medications, and so dialing back to our gastrointestinal colleagues to make sure that their gut health is good, so that we don't put them on specialized medications and then potentially cause more problems like anemia, blood loss, anything like that. Those are things that I feel our overlap is
a lot.
Quite
the other is with chest pain. I'm sending to you. You're sending to me. You rule out the heart. It's acid reflux. It's not acid reflux. We got to go to the cardiologist.
I've actually had many people come to me saying I have acid reflux, and then their stress test is so abnormal I walk them to the hospital.
Yes.
Yeah.
So acid reflux.
It's always on the radar, and it's It is definitely something that, you know, I'm really trying to dig into, like, is it really when you eat? Is it when you exercise? You know, when are you getting, are you just waking up in the middle of the night with it? All of these things may be red flags for cardiovascular disease. So.
And I think part of our mission in doing so much education around, you know, the burden of heart disease in women is that, you know, again, women have a lot of symptoms that may differ from the classic crushing chest pain, and some of it is just nausea or acid reflux, or, you know, fatigue when they walk around, and not just the classic elephant on your chest.
That's right.
We have a question, I think.
Yes, Dr. Martiak, I want you to expand a little bit on the acid reflux, where it might be something other than that, and what are the long-term effects of, I think women think that a little bit of pain is okay, and then all of a sudden it becomes a lot of pain, and you're so used to it that you don't realize that something really bad is happening. So can you talk a little bit more about other things that are going on with acid reflux?
So you're talking about primary digestive problems, like not cardiovascular, but you know, when people have atypical chest pain, and it often does relate to acid, but your esophagus also has an immune system. We see other immunologic disorders like eosinophilic esophagitis, which is a disorder where often foods, but also overlaps with acid, can create kind of like an allergic reaction of the esophagus. And so it's something, you know, we're seeing more and more of. We don't fully understand why. There's a lot of different theories on that. How our food is grown, pollution, other exposures. But, you know, so when we're talking about heartburn, it can be a lot more than acid reflux. Also, chronic heartburn is not benign. It can lead to scarring of your esophagus, you know, chronic anemia from blood loss, and then also, you know, esophageal cancer and precancer conditions.
And there are certain medications we might avoid if those states were present. I think we've discussed before, there are certain medications in heart failure, like NSAIDs, that we can't prescribe necessarily. Or if your GI tract is compromised, maybe aspirin isn't safe for you to take.
Yeah. I mean, NSAIDs, you know, they're so good, but so bad.
Blessings and curses.
Yeah. No, NSAIDs, they're bad. They're bad for the digestive tract. They thin the protective lining. They disrupt your, you know, protective lining. They cause ulcers anywhere in the digestive tract. So, you know, and that maybe that's the way it works, and how it raises blood pressure and relates to cardiovascular. But there's probably some primary vascular components to it too.
Yeah, I mean, generally cardiologists don't love that class of drugs for our patients. We try to steer towards other medications because there is a lot of overlap with a patient who already is in a pro-inflammatory state, and then you add to it medications that can be activating, whether it's just activating within their kidneys or causing some sort of other, you know, predisposition to having some plaque rupture. We try to have patients on that class of drugs for a shorter period of time as possible, and with as mild a dose as possible. I find the flip side of that is the steroids. So patients will say, well, if you don't want me to be on that, I'm going to be on steroids.
And then it's the turmeric. And then that's, you know, also causing, or it's the apple cider vinegar, the things that people are taking in super high potent doses that are, you know, also toxic to the lining of the esophagus. So, like in your food, great. A high potency supplement of those things are, you know, especially apple cider vinegar, like drinking a shot of that has been shown to cause caustic esophageal injury, and so it's always on you know, the list. So if you're doing apple cider vinegar, which I love fermented foods, that's good for your microbiome, how do we balance that? It comes back to don't try to fix things with a supplement. Try to eat right, eat your fermented foods, and that'll be in a more dilute way that's safe for your body.
I think some of that actually harkens back to some of fish oil, because we have a lot of patients that come to us on, high doses of fish oil, and we oftentimes tell them, well, it might be better if you get your omegas through your diet, but if you have to take that, sometimes the patients end up coming to you because they're having a lot of digestive issues associated with the oils.
It's true. I mean, they can cause loose stools, difficulty absorbing fats. In general, though, I would say it's one of the least offenders of the supplements, I would say. So
everyone take your fish oil.
Yeah, so I'm okay with it. I'm okay with the fish oil.
We have a question from online about something that people commonly take, probiotics. Is that something that's important to kind of add into your diet like a supplement, or to include as part of a regular diet?
I think in general, we don't know what probiotics do. And unfortunately, we just have a real lack of research here. We're not really sure if they even make it down to where they need to make it to, which is the colon. We don't know if like 9 billion or 90 billion, whatever is written on there, is a drop in the water, just a drop in the ocean. We don't know if the acid in your stomach just kills that supplement. So there's so many questions we have about probiotics that the companies are not motivated to learn about, because they are making a good amount of money without learning about it. So in general, I don't promote probiotics. For patients who feel better on them, I'm okay with them. I think they're safe, but they might cause SIBO. If the bacteria you're ingesting don't make it to the colon and decide to live in the small intestine, this may be disruptive. We don't know.
And I think that's so important. We talk about this in our series about looking at high quality randomized controlled trials. I mean, we have really good studies about diet, like the Predimed diet, you can look up online, about kind of nuts, olive oil, plant-based, as we've been saying. I'm not sure that I've seen a randomized controlled trial showing that probiotics are something we should all be recommending. And that's why I think we're not universally recommending them at this time. Another pretty hot topic nowadays is what our thoughts are about Ozempic, Mounjaro, Zepbound, all of those, Wegovy. What are your thoughts about that and how you recommend it to patients, or in relation to gut and cardiovascular health?
From a cardiovascular perspective, I do think that there are patients that will benefit from this class of drugs, especially when they have elevated blood sugars, certain cardiovascular conditions that are thriving on your body's, glucose tolerance and things like that. So I definitely have seen a lot of patients do very well on these classes of drugs. They've been able to lower their weight. They've been able to reduce their hemoglobin A1C, which is a marker of blood sugar abnormalities and diabetes. They've been able to lower their cholesterol levels. They've been able to lower their blood pressure. And it is something that I think is a really interesting facet as it relates to weight loss, which is something that we talk about with a lot of our patients, that it's not, I think we know all the nuances of weight loss, and we clearly don't, because something new came around and it has been very helpful for a lot of our patients. I have found for a lot of my patients, they are generally extremely motivated to exercise and be healthy and do all these different things, and now they actually can when they're put on these drugs. And so what will be very interesting is over time understanding how do these patients fare in maintenance doses, and how do they do over time? Is it something that they can kind of completely change their metabolic picture associated with these drugs?
Yeah, I think they're life-changing drugs for the right patient. They also have some downsides, can have a lot of digestive side effects, and I'm seeing that, but it's often balanced by, the appropriate patient on them who needs it, who's undergoing a life change. They're going to learn a lot about also, as they're eating less, what eating less does for their digestive health. Now, it's affecting motility of some of our organs, which again can disrupt us and lead to a dysbiosis. So we need to be cautious about who we put it on. And then also the people we put it on, we need to really promote now, like feeding that microbiome, because we're potentially disrupting it with medicines. And this medicine is not the only medicine that disrupts movement. So many medicines we use do. But I think for the right patient population, they're life-changing. Obviously, I'm also a hepatologist. I have cured so many people fatty liver by putting them on these drugs. It's amazing. I don't think it's not FDA approved yet for that, but I think it will be. And so it's, fatty liver, by the way, is one of the diseases that is part of the metabolic syndrome that affects our cardiovascular health. Fatty liver is the #1 cause of liver transplant in this country after we cured hepatitis C. I think a lot of people think it's all about alcohol, but actually fatty liver is non-alcoholic liver disease, and the obesity epidemic has led to a huge rise in it. And so I'm using the GLP-1 inhibitors a lot for fatty liver.
It will be amazing to see as time goes by and the pharmaceutical industry can kind of catch up with the supply and demand, how that will change the curves as it relates to certain disease processes. Because I don't think we've seen a drug come around that has had such impact in a very long time.
But like with all new drugs, there are likely going to be, downsides that are revealed over time. I mean, I think a classic one is like the proton pump inhibitors, who, like, if you have acid reflux, they are amazing. If you have injury in your stomach or esophagus, they're amazing. But over time now we've learned it's reducing the acid, it's reducing important things, important molecules, vitamins being absorbed that are, helpful for especially your bone health, and that we really don't want patients on those long term, or there are selective amount of patients that should be on them long term, and most people we're going to try to get off of them.
I think going to the topic of fatty liver, it's so amazing that you can actually reverse a disease state. So, I mean, because fatty liver progresses to cirrhosis, which is scarring of the liver, which then means that you need a liver transplant, as she was mentioning.
Or increases liver cancer. Both of those are the end stage of that.
And literally by changing that, you can actually put somebody's liver into a normal condition, the same way that we can with plaque. So plaque can regress, on statins, on, the right diet, et cetera. So there is an opportunity here for prevention in our treatment strategies, preventing progression. Right. We have another question about, if the patient discontinues Ozempic and their health kind of regresses, what?
I mean, I think it's asking if they discontinue it and...
do we go back to where we were before?
Yeah.
Yes, and I think, I think some people will need to be on these medicines long term, or the data, it's not totally clear how long you need to be on them before your body changes. And again, this may lead back to the microbiome, we don't know. Because we know obesity and thin people, they have very different microbiomes, so.
And I think still paying attention, to the insulin resistance piece of things, and that even if you're thin, you still have to remember what you're actually eating. Have talked to patients who said, now my appetite is smaller, but I'm still eating, an unhealthy diet, but it's a smaller amount of it. So it's not really serving the full purpose.
Yeah, trying to use the medicine to help change your life. That's really what we're trying to do, is using the medicine as a bridge to change your life. And that goes for so many medicines that I use in my practice.
And then I had another question about kind of people asking, how do I know if I have good gut health? What are some signs that maybe I should seek out an evaluation because something is off, because maybe it's normal to me? What are some kind of common signs that things are all in good working order?
I mean, good working order is you're not bothered by your gut. You are having, routine bowel movements, and I get the question, what's normal? My husband goes every time he eats, and I go every 2 days. That all is normal, okay, as long as you feel well. And so, if you feel well, it doesn't mean your microbiome is perfect, right? We have no way to actually know. And that's another thing that I warn patients about, is there's a lot of companies who will take your stool and evaluate your microbiome and give you a whole piece of paper saying this, that, and the other. But honestly, because we don't have it fully understood what a normal microbiome is, I find those tests to be not helpful, and it doesn't change my advice that I'm going to give somebody. I do think it's a jumping off platform for supplement use for a lot of practitioners who use those tests. I wish we had validated tests on food sensitivity testing and microbiome testing. We're just not there yet, and so.
There are some studies that I saw about looking at TMAO in mice and using it as a biomarker. So there may be in the future some biomarkers that we could use to help people understand and kind of change. And those biomarkers could then serve as potential therapeutic targets, which is an interesting field.
Yeah.
And just emerging now. I mean, some of those studies have just come out this year, last year. So I think it's an area of a lot of research and interest.
And I think that in terms of preventative health, we're learning that there's so many different lab tests and pieces of the pie that you can evaluate. So once upon a time for cardiovascular disease, we would say, do you have high cholesterol, high blood pressure, are you a smoker, are you diabetic? And that was it. Family history kind of waxed in and out of that formula. Now we have so many more variables that we're looking at, and every year there's more things that you could test for. It's very interesting to see who has, the genetic marker of lipoprotein a, and who has the inflammatory component of apolipoprotein B, and maybe TMAO is going to be one of the next things that we fold in. So it's part of the art of medicine, trying to figure out, well, what are the things that steer the ship in your body versus somebody else's body, and how do we target those things appropriately so that we can maintain good preventative health for as long as possible.
Mm-hmm. And maybe a better individualized plan for each person.
Maybe that's the future. I hope so.
Yeah, more individual.
Yeah. So we had another question about actually Greek non-fat yogurt. Is that the best, or does it matter? Is it overrated? I certainly have Greek yogurt in my fridge.
No, I'm getting hungry.
I mean, I feel like there's pros and cons. Again, if it's full fat, then we have the TMAO problem. It's fermented, which, when I bring up fermented foods, it's because that's how we used to process foods. That's how we used to store foods. We didn't have preservatives. That was the original preservative. And fermenting is, the microbes are involved in that. And so it's introducing, important microbes to your body, which we've lost that with all the preservatives that we have. Everything in the grocery store, well, not everything, but, depends on the grocery store, I guess. But, so many things in the grocery store are built to stay, good on the shelf. And so what's involved in that? And so it's almost like antibiotics, the preservatives, because they're targeting to be antibacterial. So when I bring up fermented foods, Greek yogurt is definitely a fermented food. I think overall has some benefits, but I think these guys are saying no full fat dairy.
Well, I mean, I guess I feel everything in moderation is reasonable. And so I guess if I was going to say, if you have Greek yogurt, that you maybe don't do the sweetened kind. That would be my...
Maybe top it with some fruit.
Yeah. And some flax seeds. Yeah. Chia seeds.
Now you're making me very hungry.
Maybe we should move to our dessert round of our night tonight now. I think we're going to be wrapping up. We'll take more questions after the live stream ends, but we just wanted to thank everyone for joining on the live stream and in person. We'll be around to mingle and hope to see you all at our Women's Heart Conference in February.
Thank you so much.
Thank you.
Thanks.
Thank you. Thank you, Dr. Weinberg and Martia.